So this is IDD therapy. It's primarily used for disc injuries, persistent chronic back problems and sciatica, but we do also use it to treat similar things in the neck, so people who've got, again, persistent neck pain, often associated with pain into the arm. Disc injuries are extremely common. They are something that blights lots of people's lives. Often they respond to manual therapy, so, not quite often, they'll respond to anti-inflammatories and painkillers. But people do often go down the path of taking the painkillers, seeing the GP, taking more painkillers, being referred to a physio. They see the physio helps them to an extent, but they're still not better. They go back to the GP refers them to a specialist. The specialist sends them for an MRI. The MRI scan identifies that they've got a bulging disc in their back or their neck, which often is pressing on a nerve. And at that point, once they've gone through that system, they may also, alongside that, be having some osteopathy or chiropractic or acupuncture, those sorts of things. And in the majority of cases, those remedies will work. But there is a percentage of people for whom that doesn't have the desired impact, and they're left in a situation where they end up seeing a spinal surgeon, and the spinal surgeon has basically got two options for them. One is to inject them, and the other one is to operate on them. And there are plenty of people in this world who don't fancy the idea of injections. And the success rate with injections, whilst they can be very beneficial for some people, it's often only a temporary solution, and for some people it has no impact whatsoever. And then surgery is quite a scary thing. Although spinal surgery is much less scary than it was 20, 30 years ago, not everybody wants to go on the operating table and have a surgeon rummage around inside them and kind of start removing bits of disc and things like that. Now, there are a percentage of people for whom that is the only option, but there's a good chunk of people who have been kind of advised that they may need injections or surgery, for whom there is another option, and that is IDD therapy. And what we do with IDD therapy, the idea basically is to decompress, which is the idea of surgery as well, is to decompress the nerves that are being impinged upon and therefore reduce the pain they're experiencing in a limb, and also mobilise the part of the spine that's affected, stretch the muscles out a bit and just improve the function of the spine. And I believe it's a tool to get people comfortable enough so that they can do the right sorts of rehabilitation exercises so that they can then improve the situation overall. So I don't tell people that IDD is a magic bullet to kind of alleviate all ills. It's a tool that we can use, which is different to the manual therapy we provide. And sometimes we'll do manual therapy alongside the IDD, because sometimes people need a little bit of hands-on treatment as well. But this is a tool that can get people out of pain sufficiently such that the more conservative remedies plus the exercises become much more effective. And so we've got quite a good track record of keeping people out of the hands of the surgeons, off the operating table, and getting them back to functioning at a good level, including people who go back to playing the sport and things like that. So, yeah, I mean, if it works, and it doesn't work for everyone, and I make no bones about it, and there are some people who come and see me, and I look at their scan reports and the images, and I tell them it's not appropriate, it doesn't stand a great chance of working. I make no bones about that. We're not in the business of kind of just throwing everybody onto the machine willy-nilly. I try and pick the people who I think have got a really good chance of success. But when it works massively well, and people do end up in a situation where they are much more comfortable, much more mobile, much more active. These sorts of problems often impact their ability to work and that sort of thing, and you quite often find people who are, as a result of the pain and the discomfort and the stiffness and things like that, they become quite low, and therefore this sort of treatment can get them A, out of pain, B, improve their mental health and things like that as well, because they're just happier about life because they're not suffering.
Do I need to wear shoes?
No, you don't need to wear shoes, Charlotte. In fact, you don't need to take any clothes off at all. As long as you've got loose-fitting, comfortable clothing on, you'll be absolutely fine.
Brilliant, thank you.
No problem at all.
So, can we have a little demo of how the machine works?
We can have a little demo of how the machine works.
Okay.
We've had the machine since 2014, so we've got pretty good at doing this these days. It's set up at the moment for treating lower backs. We would have a different setup if it was a neck problem, so this would be a treatment for a lower back. The reason it stands up like this is so that people who've got poor mobility can get on and off it much easier, because if you've got a really bad back and really bad sciatica, if this was flat, it's quite high up and it'd be difficult to get yourself on it. So this makes it a much easier process for people to get on and off it. Okay, and we've recently installed a grab rail to make life much easier for people to pull themselves off the machine as well. They've got something to hang on to. So what happens is, under normal circumstances, we go through a consultation, examination, things like that. And once we've ascertained that you are a suitable candidate for treatment, we've gone through a consent form and described the process to you, then we start the treatment. When people come in, what we normally do is put them on a heat pack for 15 minutes just to get some heat into the muscles, get the blood flowing, relax everything a little bit. It makes the treatment a bit more comfortable and a bit more effective as well. And then what we need to do is then put 2 harnesses on. So these are the 2 harnesses here. This is the one that goes around your pelvis. So if I can ask you to, if you face me to start with, you can do pirouettes if you like. Just hold that there for me.
And can this be adjusted depending on people's size?
Yes, I've got three different harnesses: small, medium, and large. So the machine is effectively rated to treat people up to, I think, about 30 stone in weight. So
wow.
Yeah, you can put people of almost any size on the machine quite easily. It's good. Right, if you just move your feet apart slightly for me.
It's nice and comfortable.
Good. The treatment itself actually is pretty comfortable. We have people who doze off while they're on the machine. That's often.
Lovely. I can have a nap.
Yeah, that's often because they find they're in pain, and sometimes just by the stretching mechanism, it takes the pressure off enough for them to become much more comfortable. So this is the chest harness. I'm going to put it over your hair. Sorry, we'll move that in a second. Hold on to that strap there for me. And hold on to that strap there for me. I'm just going to bring this around the front. Okay, marvellous. So, next step. If you step onto the machine there for me. Step. And just ease yourself back and put that behind your head. There you go. Slightly odd sensation this.
Oh.
So the machine moves very slowly and gently because you don't want any jolting and jerking for people who are in a lot of pain. It's not a nice sensation to be thrown about when your back is playing you up to that extent. So
It's very comfortable.
Good. It should get more comfortable in a minute.
Lovely.
Okay, just lift your head a second for me and back down again. So, I'm going to tighten the straps on the pelvic harness. The idea being that the pelvic harness is attached via this strap here to the machine, and then the chest harness is attached to the top of the machine. And effectively, the chest harness holds your top half in place while your bottom half is pulled towards the machine, basically.
What a release.
It can be, and as I say, people do tend to find it pretty comfortable. Right, if you just bend your knees up for me so your feet are resting on there, and just give yourself a little push up towards me. Keep going, lovely, that's fine, keep your knees bent up. So I'm just attaching the chest harness to the top of the machine. And slide this in under your knees. Good. And then these two go under your ankles. There you go.
Oh wow.
Comfortable?
Comfortable.
So that is a position, if you're in that position, then there is very little pressure on the discs in your spine in that position. That position in itself will take quite a lot of the compression out of the situation. So what I've done there, I've just attached the the pelvic harness to the machine. Right, take a deep breath in for me, and all the way out. This is the one bit that people don't like very much because the chest harness has to be reasonably tight around the ribs.
Yeah. I feel very skinny.
Just lift your arms up a second. There you go. And then we give people this. The only time anyone's ever needed to press this button was when the machine was putting their trousers down. But in theory, if something doesn't feel very nice, press that button. It stops the machine in about 10 seconds. Okay. So that's you strapped in, ready to go. And what now happens is that I've set everything up on here, and this is completely adjustable depending on the patient. We depending on where the injured disc is in the spine, we can change the angle at which we pull to target each disc.
Wow.
More. There's always a bit of overspill. I can't say it's focused entirely 100% on one disc, but by changing the angle, we can make sure that most of the forces are directed in one area. And we can vary the intensity of the treatment, and there are a few other settings we can change just to enhance the effects of the treatment. Patients are on the machine in total for about 26 minutes. So it's a slow process, it's a gentle process. We gradually increase the intensity of the treatment, but at a starting point, people often don't feel a great deal. So I'm going to start the machine off. Now what will happen is over the next 2 minutes you'll feel a pull start to build up through the pelvic harness.
Yeah.
I'll put it on quite a low setting for you. You're not suffering from enormous amounts of back pain. The thing I should say is the treatment's very safe. The worst outcome I've had with a patient with this is that they just haven't got any better. I've not yet had a patient who's got worse as a result of IDD therapy. So it's a very safe treatment. And you can use it for people who haven't got significant issues with their backs. It's quite nice just to get your spine stretched out a little bit, because day-to-day life, gravity, sitting, bending, twisting, are all putting compressive forces on the spine. So we don't ever, unless we dangle upside down like a bat, we don't ever do anything that really that decompresses our spines. So just being on there, kind of stretching it out, is quite a nice thing to do from time to time. You can probably feel it start to feel a little bit of pull building up.
Very gentle.
Yeah, it comes on very gradually, so it builds up over a couple of minutes. It'll get to a maximum point for this particular session. It'll hold it there for 60 seconds and then it backs off again to a halfway point. Stays like that for 30 seconds and then builds back up again and holds it again. So there are 13 cycles like that. In one treatment. Although again, that's a parameter that we can change if we feel like we need to, depending on what's wrong with the patient, age, size, all sorts of factors that you can throw into the equation. But one of the other beauties of this is that it's entirely repeatable. So if you find a kind of sweet spot and the patient reports that the previous treatment had a really good effect, you can set it up to do exactly the same thing again. Whereas with manual therapy, yes, you can effectively repeat the treatment, but you're never 100% certain you've done exactly what you did the previous time. With this, you can kind of guarantee that it's completely repeatable each time. And patients do often find they may not get much benefit in the very early stages, but you suddenly hit a little bit of a point during the course of treatment where you go, actually now I'm starting to feel some changes. It may be that you just keep the treatment like that for 2 or 3 sessions just to maximise that benefit before making it a little bit more intense again. It is quite an intensive course of treatment. In the early stages, I recommend to people that they come 3 times a week for about 4 weeks. So we get 12 treatments in a short space of time, and that's because it has a cumulative effect. If you just did it once a week, you'd start to life would happen, and all the compression that was on that area that you alleviated in that one session would just come piling back on again. If you keep repeating the treatment fairly frequently, over time the body adapts and changes, and you start to stretch things out and mobilise things, then it starts to stay like that for a little bit longer. So if you get those compressive forces happening early on, or decompressive forces happening early on, and keep doing it, you gradually take the pressure off, and the body does adapt, and the pressure comes off the nerve, and people get more comfortable and they get more mobile, and once they're more mobile, it helps them improve further. So it becomes a virtuous cycle at that point.
Wow.
So you could do it once a week, but I don't think you would have anywhere near the same impact. So 4 weeks, 3 times a week, and then as the treatment gets a bit more intense, we tend to go down to twice a week and just keep it at that for a few weeks. The number of treatments that people require varies wildly. Some people, you can get a very big improvement in 10 or 12 sessions. Other people, you can get up to 20, 25 treatments for them to get a really good response. And there are unfortunately a few that don't respond, but that's the same with any treatment. But so I tend to say to people, have 12 to start with, see where that gets you, and then if we need more, we'll continue. But often by that point, people are seeing the benefits of it, and will happily continue because they're starting to get the improvements they're looking for.
Wow.
So what's that feeling like at the moment?
Relaxing.
Yeah?
Yeah, it's a lovely position. It's very cushioned, very comfortable.
So what we do, and I will do this in just a second. I wouldn't normally necessarily do this on the first session. Don't worry, it's not going to do any harm.
That's okay.
There are a couple of catches under here that I can undo, and it actually allows the table to separate, which is, this isn't much of a spectator sport, unfortunately, but undoing those catches does allow the table to open out, and it increases the strength of the stretch a little bit. So you can probably feel the machine just easing off at the moment.
Yeah.
So I'll just undo those catches, and the next pull will feel just a little bit stronger.
Lovely. It's like it's doing the stretching for me.
Yeah, well that's
great.
And that is the beauty of this compared to, say, my hands. This can apply a greater force for a long period of time than I can manage just using my hands alone.
Yeah.
So if a decompressive force, a distraction force as it's called, is proving to be beneficial, then by doing this for prolonged periods of time, you can get quite a significant improvement.
Yeah. It's a lovely relief.
So,
wow.
There you go. Does that feel slightly stronger now?
Yeah, but not comfortable.
Yeah. So as I say, I've set it up on a fairly low setting, so I know it's not going to be particularly challenging for you at the moment.
That's okay.
But so it will just kind of be stretching the base of your spine, and I've set it up to target the very base of your lumbar spine, the last sort of mobile parts of your lower back. I've set it up to target that. So
how many discs do we have?
So you've got seven vertebrae in your neck, 12 in your mid back, your thoracic spine, and then you've got 5 vertebrae in your lower back, and there's discs between each of them, with the exception of the very top of the neck. So you've got 5 lumbar discs, you've got 12 thoracic discs, effectively 6.
Wow. So
it's very rare to get problems with the discs in the mid back, in the thoracic spine, because that doesn't move very much. It's got a rib cage attached to it, so you've got a big bony ring there. So there's not a great deal of movement. It's quite a solid structure. And we can't treat those discs anyway using IDD because the machine just isn't set up to get to those points. But thoracic spine disc injuries are extremely rare. Neck and lower back disc injuries are more common than you might think, because you can, I could go and grab somebody off the street and put them in an MRI scanner and probably see a disc problem that they don't even know they've got. So is it a problem? No, because they're not in pain. But discs do come under quite a lot of stress, and it's not uncommon for people to have disc injuries they don't even know they've got. Now those disc injuries may or may not become problematic at some point in their lives, but a lot of people are walking around, as I say, with discs that on a scan don't look great. And this is partly why I say I don't put everybody with a disc injury on the machine, because sometimes you look at somebody and you think, well, actually, is it that disc that's causing the problem, or is it something else? And that's just a coincidental finding. So you do have to you have to filter them out a little bit. because it'd be very easy to send lots of people off for a scan and go, oh yeah, disc injury there, get on the machine. That's not the way it works. You need to be convinced that their disc injury is causing the problems that they're experiencing, and that it is amenable to treatment as well. So,
and this is what you work out through your consultation?
Yeah, through consultation. I always get people to have an MRI scan before I put them on there, because it's part of your process of deciding whether they're a good candidate or not. It's not the only thing we base it on, because patients will often tell you what's wrong with them, and you get a pretty good idea of what the issue is, even without some imaging. But if we think, well, yeah, I'm fairly certain this is a disc injury and it's causing sciatica or whatever, then you can get a scan done and go, okay, well, it's this disc here, so we can set the machine up to target that area. You do get people who've got multiple disc injuries, and you then have to decipher which one you think is the one that's the most likely kind of cause. So without a scan, it's a little bit kind of a shot in the dark, but the scan kind of allows you to understand more about what's going on without being the kind of be-all and end-all in terms of diagnosis. But it does also sometimes show up things which make you think actually IDD isn't appropriate as well. So I'll let it do this last little stretch, and then I'll shut the machine down for you and get you off again.
Wow.
Because you've been on there nearly 10 minutes now, so...
Love, it's a relaxing... I can see how this relieves the pressure for people with pain.
Yeah. I mean, as I say, it's not set up as a particularly strong treatment for you at the moment.
Yeah.
I have had patients. One of my patients was a very solid bodybuilder, and we had to make the treatment quite intense for it to have any impact, because his muscles were just so dense and strong that to make anything happen needed quite a lot of oomph. So he started ramping it up until he kind of went, oh yeah, now I can feel it. So I'll just press the stop button in just a second as it eases off, and then you'll feel it just gradually take the pressure, take the stretch off again. There'll be a bit of beeping as well.
Wow.
So, unhook you again. I'll switch that from you. This is a bit of a reverse engineering thing now.
Right.
Let me undo that. Take those out from under your ankles. Slide that out from under your knees. Take it out from under your head. So it's not uncommon after IDD therapy just to nudge yourself down a little bit for me. It's not uncommon, and I'm not expecting you to experience this, but it's not uncommon people to feel a little bit stiff and achy immediately afterwards. That normally goes away quite rapidly. The application of a bit of heat or a cold pack will often deal with that, or sometimes just walking back to the car is enough to kind of get it all moving again. There we go.
I like that.
Good, I'm glad you liked it. I'll take the pelvic harness off you again. There we go.
See how people fall asleep.
Yeah, there you go.
Fabulous.
So that is IDD.
That is the IDD therapy machine. Thank you very much,
Cool.
Michael. And how can people book that with you?
So we tend to get people to call up for that. We do offer a free 30-minute consultation to people to kind of assess their suitability, talking through their options and discuss the implications both in terms of time and cost and the likelihood of it succeeding for them, and then they can make a decision on whether they want to proceed with it or not. So yeah, call us up, we'll book you in and we'll have a chat and see whether we can go from there.
Brilliant. Thank you very much,
No
Michael.
problem.